Coronavirus disease COVID-19 personal protective equipment for healthcare workers. Contents: Introduction, Background, Definitions, Symptoms, Incubation period, Prevention, Personal protective equipment, Infection control precautions guidelines, Chain of infection, Donning, doffing, General rules. Background: In late December 2019, an outbreak of pneumonia cases of unclear etiology was reported in Wuhan City, China. Virus spread to human and caused severe acute respiratory syndrome coronavirus SARS-CoV. Based on genetic similarity, the novel coronavirus was officially named SARS-CoV-2. Coronavirus disease COVID-19 is a respiratory infectious disease caused by severe acute respiratory syndrome coronavirus SARS-CoV-2. By March 11, 2020, the World Health Organization officially declared a global pandemic. Till May 12, 2020, the virus had spread to at least 187 countries with total confirmed cases reached more than 4 million and killed more than 280,000. SARS-CoV-2 is a highly contagious virus that can infect healthcare personnel. Specific care activities, in particular aerosol-generating procedure, may have a higher risk for transmission. The rapid emergency and global spread of SARS-CoV-2 has created a significant challenges in healthcare facilities, particularly with severe shortage of personal protective equipment used to protect healthcare workers. Definitions: COVID-19 is the disease. SARS-CoV-2 is the virus. PUI, patient under investigation. HCW, healthcare workers. WHO, World Health Organization. CDC, Center for Disease Control and Prevention. PPE, personal protective equipment. COVID-19 symptoms. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. That include fever, cough, shortness of breath or difficulty breathing, chills, muscle pain, headache, sore throat, and new loss of taste or smell. Incubation period. These symptoms may appear 2 to 14 days after exposure to the virus, with a mean of 5 to 6 days. Prevention. No vaccine is currently available. Treatment is still under trials. Prevention at personal level. Hand hygiene, wear a mask, cough etiquette, social distance, stay home if ill, don't touch the face, eyes, nose with contaminated hands. At facility level, minimize chance for exposure by adhere to standard and transmission-based precautions. Take precautions when performing aerosol-generating procedures. Train and educate healthcare personnel. Implement environmental infection control. Personal protective equipment for COVID-19. Infection control precautions guidelines. The following guidelines is based on CDC interim infection prevention and control recommendations for patients confirmed with or under investigation for coronavirus disease COVID-19. CDC guidelines call for strict adherence to standard, contact, and airborne precautions, including the use of eye protection. Guidance for the donning and doffing of PPE for COVID-19 according to the CDC guidelines. Standard precautions, contact precautions, airborne precautions, plus eye protection. Chain of infection. When preparing to care for a patient with infectious disease, it's helpful to understand the series of events that occur to cause the infection. This series of events is known as the chain of infection, and each link of the chain of infection gives us an opportunity to break the chain and prevent the spread of the disease. Chain of infection, pathogenic organism. The chain of infection begins with the presence of an infectious agent or pathogenic organism. To break the chain of infection and prevent the spread of a pathogen like COVID-19, the pathogen must be removed or destroyed. Chain of infection, breaking the chain. Healthcare worker performing hand hygiene with alcohol-based hand rub to disinfect their hands is an example of breaking the chain of infection by destroying the pathogens. Chain of infection, reservoir. To continue to survive, an infectious pathogen requires a reservoir or a host in which it can live, reproduce, and multiply. In this case, a human infected with COVID-19 are considered as a new host reservoir for this virus. Chain of infection, portal of exit. The portal of exit in the chain of infection is the path by which a pathogen leaves its host to infect others. For COVID-19, the portal of exit includes the respiratory tract. The respiratory secretion when a patient coughs or sneezes or talks. There may be other portal of exit such as the gastrointestinal tract via stool, but for now we will focus on the respiratory system. Break the chain of infection at the portal of exit. Have a patient wear a mask to block respiratory secretion is one way to break the chain of infection at the portal of exit. Chain of infection, mode of transmission. The mode of transmission is the means in which the pathogen travels to a new host. SARS-CoV-2 stay from hours to days on different surfaces. The mode of transmission is contact, droplet, and airborne for COVID-19. CDC recommended precautions, standard, contact, airborne precautions, eye protection. Chain of infection, portal of entry, is the path in which a pathogen enters a new host. Person-to-person spread, spread from contact with infected surfaces or objects. Person-to-person spread. Transmission most commonly happens during a close exposure to a person infected with the virus that causes COVID-19, primarily via respiratory droplets produced when the infected person speaks, coughs, or sneezes. Spread from contact with infected surfaces or objects. Transmission also might occur through contact with contaminated surfaces, followed by self-delivery to the eyes, nose, or mouth. Break the chain. Healthcare workers wearing personal protective equipment that offer respiratory protection, preventing the inhalation of an infectious pathogen, is one way the chain of infection can be broken at the portal of entry. Chain of infection, susceptible host. A susceptible host refers to a person who does not have the ability to fight off the invading pathogen. To break the chain of infection at this point would require the potential host to have immunity to the pathogen in question. In certain situations, immunity to pathogen can be acquired naturally as a response to past infections, or it can be artificially acquired by vaccination. Break the chain. The chain of infection is a useful tool, and consideration should be given to methods for breaking links in the chain early in the process. For example, healthcare workers caring for patients with COVID-19 can break the chain of infection at the mode of transmission and portal of entry by wearing appropriate PPE. Personal protective equipment PPE. General rules. CDC recommended standard, contact, and airborne precautions with eye protection in caring for patients or persons under investigation for COVID-19. PPE includes disposable isolation gown, N95 respirator, face shield or goggles, gloves. Each facility will have variation in the types and styles of personal protective equipment or PPE that is available to staff. What's important is that the PPE chosen must provide protection for the anticipated task and the level of isolation. PPE should be durable, non-restrictive, and fit well. Training on the correct use of PPE should be provided to staff. Additional general rules, necessary items. Additional items that will be required include alcohol-based hand rub, approved disinfectant wipes or spray, waste container with a red biohazard bag. Donning personal protective equipment should occur in a space where it is safe for personnel to be without PPE. Gather the PPE items that will be required from the supply area to having one location at the start of the donning process. All PPE must be donned prior to entering the patient care area. Check each item of PPE to ensure there are no defects such as rips in the gown, seams or creases on the face shield. Staff with long hair should tie it up and preparation to don PPE. Staff with facial hair should shave in order to wear an N95 respirator. Wearing jewelry is discouraged as it can lead to breaches in infection control and PPE. Donning PPE. Perform hand hygiene. Always begin the PPE donning procedure by performing hand hygiene. CDC and World Health Organization both provide excellent instruction on how to perform quality hand hygiene. For links to these resources can be found at CDC and WHO sites. Donning PPE. Hand hygiene. Apply to the manufacturer's recommended amount to the palm of one hand. Rub hands palm to palm. Rub the right palm over the back of the left hand with interlaced fingers and vice versa. Rub both palms together with fingers interlaced. With the left thumb clasped in right palm, rub rotationally and switch. Rub the clasped fingers of the right hand forward and backward in a circular pattern on the palm of the left hand and vice versa. Finally, rub both hands together with fingers closed until the sanitizer is dry. This process should take no less than 20 seconds to complete. Donning PPE. Gown. Gown must meet the standard criteria for the anticipated task and the level of isolation. Donning PPE. N95 mask. It is important that the staff use the same size and style of N95 respirator that they did during the annual fit testing. For proper placement, N95 mask must fit close to the face. There are two straps of the mask. Put the top strap on the crown of your head and the bottom strap at the nape of the neck below your ears. Don't X-cross straps. Once the mask is in place, the nosepiece should be gently molded to the bridge of the nose and seal-checked, performed by inhaling and exhaling quickly using the fingers to feel the air leaks around the edge of the mask. Donning PPE. Eye protection, face shield, or eye goggles. If wearing goggles, ensure they do not interfere with the N95 mask fit. Donning PPE. Gloves. Don gloves and ensure that there is no skin exposed between gloves and gown cuffs. General rules with donning PPE. Take precaution to keep from contaminating your PPE. Avoid readjusting your PPE while in the patient care area. If gloves become grossly contaminated, perform hand hygiene on the gloves. Remember to perform hand hygiene as you normally would when caring for patients. Before touching the patient, before clean or aseptic procedure, after body fluid exposure, after touching the patient, after touching the patient's surroundings. Doffing PPE. Doffing must be performed in an area where it is safe to do so. CDC recommends that it should be at least 6 feet from the patient and in a way that will not contaminate your PPE. With the exception of your N95 mask, all of your PPE may be doffed by the door inside the patient care area. The doffing process must be performed in a way that prevents contamination to you from your potentially contaminated PPE. Doffing PPE. Perform hand hygiene. Perform hand hygiene over the gloves for a minimum of 20 seconds. Doffing BBE gloves. Remove gloves correctly and put them safely in the trash. Doffing BBE gown. Remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently and avoid a forceful movement. Reach up to the shoulder and carefully pull or roll the gown away from the body. Dispose the used gown into the trash. And perform hand hygiene. Doffing BBE face shield. Don't forget to wash your hands before and after removing face shield or goggles. Doffing BBE N95 mask. Remove N95 mask one strap at a time. First remove the bottom strap and then remove the top strap. Doffing BBE. Exit the room, leaving the patient care area. Doffing PBE. Perform hand hygiene. Finally, perform hand hygiene for at least 20 seconds. Safe donning and doffing practices. If at any point you feel as if you have been exposed to pathogen, then contact your supervisor and follow your facility protocols.